Around 2 million West Australians in the Perth and Peel regions have spent 12 days in lockdown this year, 5 days in February, then 2 shorter stay-at-home orders in April and June-July. The Southwest region has had just one 5-day lockdown. None of the lockdowns were extended. Tens of thousands of people were tested and the virus didn't spread. But there's a cost. Treasury says February's 5-day lockdown cost the WA economy around $120 million. April's 3-day shutdown cost about $70 million. It's too early to say what economic impact the most recent 4-day lockdown has had. Peak business groups, however, estimate the total economic cost of the 12 days in lockdown is over $100 million more. The state government has already committed $116 million in support relief for impacted charities and business. While some epidemiologists argue WA has called snap lockdowns too early, one economist says the cost of a serious outbreak could have been far worse.
Go early, go hard, lock down for a sufficient period of time to make sure you're not having people who are infectious in the community, and then open up as soon as it's practical.
The Chamber of Commerce and Industry says it's becoming tougher for business to cope. A recent survey found 1 in 10 believe they wouldn't survive another lockdown. What's harder to quantify is the unseen social consequences. Experts say isolation, loneliness, plus the uncertainty and disruptions of snap lockdowns can have an impact on mental health. So when will snap lockdowns end in WA? Well, that depends on the state's vaccination rate. WA's Chief Health Officer Andy Robertson wants 80% of the state's population to be vaccinated before reconsidering snap lockdowns and border restrictions. He believes that target may be met by the end of the year, subject to supply and other factors. The most recent federal health figures show 10.5% of WA's population is fully vaccinated so far, the lowest number of any state or territory. The Northern Territory has the highest vaccination rate of 22%, followed by the ACT, 19%, and Tasmania, where 18% of its population is vaccinated. WA's rate may have been impacted by COVID complacency, vaccine hesitancy, and national vaccine supply.
There are those under 40 who want to have the vaccine, but they just can't actually book a place because there's not enough vaccine supply.
Public health experts say reaching an 80% target this year is ambitious but not impossible.